What if I can't get newer anti-inflammatory drugs for CF? Imagine your lungs fighting a constant battle against inflammation and infection. When newer anti-inflammatory drugs for cystic fibrosis are not available, there are still effective ways to help manage inflammation and support lung health. The goal of anti-inflammatory treatment in cystic fibrosis is to reduce swelling in the airways and slow down lung damage caused by ongoing infections and immune responses. Older but proven medications like ibuprofen and azithromycin can still play a vital role. Ibuprofen, a non-steroidal anti-inflammatory drug, has been shown to slow lung deterioration when used carefully and with regular monitoring, because it can have side effects if not dosed properly. Azithromycin, often known as a long-term antibiotic, also has anti-inflammatory effects. It helps improve lung function and reduces flare-ups by calming immune responses and fighting bacteria that tend to infect cystic fibrosis lungs. If these options are not suitable, other strategies can help. Corticosteroids, whether inhaled or systemic, can reduce inflammation but are less favored for long-term use because of potential side effects like weight gain or bone thinning. Natural anti-inflammatory agents such as turmeric extract, bromelain from pineapple, and glucosamine have shown some promise in reducing inflammation in general, but they are not substitutes for prescribed medications and should only be used under medical supervision. Research is ongoing into new therapies that target the cellular pathways involved in cystic fibrosis inflammation. For example, some experimental drugs aim to activate NRF2, a protein that helps reduce inflammation at the cellular level. However, these are still in the research phase and not yet available for routine treatment. Beyond medications, lifestyle measures are essential. Good nutrition and staying well hydrated help keep mucus thin and support your immune system, which can reduce inflammation indirectly. Regular airway clearance techniques and physiotherapy help remove mucus buildup, decreasing the chances of infection and inflammation. Keeping vaccinations up to date is also crucial because preventing respiratory infections lessens inflammation and lung damage. Working closely with your cystic fibrosis care team is key. They can help tailor your treatment plan based on what medications are available, how severe your disease is, and how you respond to different therapies. If newer anti-inflammatory drugs are not accessible, your healthcare provider can optimize existing treatments and supportive care to keep your lungs as healthy as possible. In summary, even without access to the latest medications, older drugs like ibuprofen and azithromycin, along with natural supplements and supportive care, remain as important tools. Always consult your cystic fibrosis specialist before making any changes to your treatment plan to ensure safety and effectiveness. Remember, managing cystic fibrosis is a team effort, and there are many ways to support your lung health, no matter what options are currently available.